Good morning, everybody. It's 7 o'clock. The Prime Minister is promising to throw everything at the booster drive, with every adult in England able to book a third jab by the end of January. That's booster jabs for 23 million people, a huge effort that will require an army of volunteers and the real army to help expand the capacity of the NHS and get needles into arms. We're going to be speaking to the Health Secretary Sajid Javid very shortly, along with Scotland's top health advisor, and to Labour about why they want tougher travel restrictions. And
the doctor said you're HIV positive.
He was in hospital and he said, Auntie Ada's come to call.
I felt like I was the walking dead.
World AIDS Day, going to be speaking to one of the longest living people in the UK diagnosed with HIV about the new Sky documentary, which tells the story of Britain's 40-year battle with the virus. And tougher penalties for child abusers. Tony's Law, named after a very brave little boy, Tony Hudgell. There he is, bless his cotton socks, has the government's backing after a 4-year campaign. Going to be speaking to Tony and his mum and dad within the next hour. It's Wednesday, the 1st of December. Don't cancel Christmas parties, the message from the Prime Minister, despite advice from one of his most senior health officials to cut out unnecessary socialising.
Boosting the booster. I'm live at a vaccination centre in Surrey, where the government is throwing everything at its booster campaign.
Also ahead, a new report reveals hundreds of thousands of potential cancer cases could have been missed during the pandemic. High school shooting. A teenager is in custody after 3 pupils were killed and several injured in the US state of Michigan.
I think this is every parent's worst nightmare.
The first accuser in the Ghislaine Maxwell sex trafficking trial says she was abused by Jeffrey Epstein when she was 14, with a British socialite in the room. Morning. The Prime Minister, Boris Johnson, is promising that more than 23 million people will be able to book a booster jab by the end of January. It's a massive expansion of the vaccine programme, and the government is appealing for thousands of volunteers to help the NHS. Temporary vaccine sites will be set up around the country, and around 400 military personnel will assist the rollout. But if Mr Johnson had another message, it was that Christmas is safe and there is still time to party. The Health Secretary Sajid Javid is with us. Lots to get through. Let's talk. Good morning to you.
Good morning.
Let's start, first of all, with our viewers. Sense of exhaustion this morning that we have to deal with another twist and turn in this COVID challenge. How are you coping with it all?
Well, there's a lot of work to be done, and I'd just actually start by thanking all the people in the NHS, especially in social care, for, think of the 2 years that they've had, the most challenging time, I think, fair to say, in living memory for anyone working in care and health. And now, this variant comes along, and it's we have to still ask more of them. I know they're up to it, but it's a big ask, and I just want to start by thanking them. And I mean, with this variant, we're trying to learn and assess more about it. And in that meantime, in the next few weeks, we want to build our defences. And our best form of defence still remains our vaccines. It's possible, of course it's possible, but it might be less effective. We just don't know for sure yet. But it's also very likely that they'll remain effective against serious disease. And that's why we made the announcement around the booster programme yesterday. I asked the JCVI, that's our group of independent advisors on vaccines, whether it would now make sense in light of this variant to really expand the programme. It's already really successful, but to really properly expand it. And they came back and said we should do just that by dosing, halving the dosing interval, and also by expanding it to all adults. And it's a real national mission, I would say, for all of us. We've all got a role to play on this. And if any of your viewers, if they get the call from the NHS, then please do, I would just say to them, please do, step up, roll up your sleeves and protect yourselves.
23 million booster vaccines to be slated by the end of January, though. That's a tough ask, isn't it? That's, what, 500,000 a day?
It's a huge ask, and it's something I do believe that all the people working in the NHS, all the volunteers, they are up to it. But it of course is a huge ask, and that's why I call it a national mission. This has become, from a health point of view, the most important thing that we can do to protect ourselves, to protect the progress that we've made. But I know that the NHS are up to it. In the last week, before sort of Omicron was a thing, I think delivered about 2.4 million vaccinations across the UK, and that's obviously that's huge. We need to now increase that by around a million a week, but I think it can be done to give everyone an offer by January. But it's really important that people take up that offer, because that's what's going to protect us.
Let's canter through. Lots to talk about. The PM says the new rules will be assessed after 3 weeks. What criteria will you use?
The key thing will be the assessment of our scientists of the variant. Now, what we need to determine, is it any more dangerous than the Delta variant? And as I say, we don't know the answers to that. We've seen in the last few days a number of scientists, whether from here, from South Africa. I spoke to my counterpart in South Africa yesterday, and let me also just say, I think the way South Africa has behaved is exemplary in being open and transparent about what it discovered. But in talking to other scientists, we don't know enough about it yet, but that will be the key thing, is to determine if it is any more dangerous than the current dominant variant, the Delta variant.
3 weeks is an arbitrary figure, isn't it, really? Because it could take longer than that for us to know whether people have got it and then find themselves in hospital. We won't know within 3 weeks just the challenge that we're facing with this.
Well, I wouldn't call it an arbitrary figure. I think where you might be a bit right is that only a bit. Is that it might take a bit longer than 3 weeks. It might be a bit sooner than 3 weeks.
The thing is, 21st of December as opposed to 25th. You can see where I'm going with that.
Yeah, no, of course, and that's why we're confident that actually maybe within 2 weeks that we can know a lot more about this. We might not even need to wait 3 weeks, but the 3 weeks was, I think, a sort of a sensible date to set for a review, because now that we have live samples of the virus, they've gone to our labs in Porton Down. Our scientists, some of the best scientists in the world, are working through it. We're working with our G7 colleagues. I held a meeting with G7 health ministers on Monday as well to discuss this. And so we're working internationally. We're working at pace at home. And I think in a couple of weeks, we will know a lot more about this variant.
Between now and then, the Prime Minister said we should be attending Christmas parties. The Chief Advisor is saying we shouldn't. Where are you?
Well, I think people should continue to behave in the way that they were planning to behave over Christmas. I don't think there's any need to change those plans. The only changes that have been made in the last few days are the ones that everyone now, I think, knows about it might affect your international travel plans. So if someone had plans to travel over Christmas, then there could be an impact there, of course. There's the need to self-isolate if you come into contact with someone with Omicron.
Yeah, are you worried about a pandemic?
No, I'm not. The case numbers are well, at this point in time, the case numbers are very low. I think throughout the UK, we've got 22 confirmed cases at the moment. Now, that will go up. It will certainly go up. But the numbers are low. I hope it sort of stays that way. So I'm not worried about the sort of pandemic type situation. But we've always also said that even before we knew about the variant, in our sort of plan A, we've always been clear that as you get into deeper winter, the colder, darker days, the virus likes that. Not just this virus, the flu virus, they like that. And so, as we do that, then people should just be careful to try and think, can they ventilate a room, and just follow the current guidance.
Let's crack on. Should people take a test, a COVID test, before they go to a Christmas party?
I would. It's not a formal recommendation, the guidance, but if I was going to a party with lots of people and things, I would. But I would have done that, by the way, even before we knew about this variant. Again, the reason I would have done that is because it's getting colder, it's getting darker, we're spending more time indoors, probably more people indoors than before, just because of the colder, darker days. So are sensible precautions that everyone can take.
You're talking about overseas travel. Labour is saying that there should be pre-departure tests from the country that you are in before you come into the UK. Why don't we do that? We used to do it.
We did used to do it, and we got rid of it because we didn't think we needed it anymore. When the variant came along, and with what little we do know about it, we had to. It was right to take some measures around travel, and the most important one we actually took is the red listing. So, the moment I learned about this virus and the potential threat of it, within hours, we red listed 6 countries in Southern Africa. We've added 4 more. We were the first in the world to do that. And then also we've put in this measure around if you come in from anywhere in the world, that you will have to take a PCR test by day 2 and only leave isolation if you get a negative test.
Is it under review, the pre-departure testing?
Well, we keep all these rules under review. I don't anticipate any change from what we've announced just in the last few days, but of course we always keep it under review. Should the situation change, then we would have to look at that again, but I don't really anticipate any change for now.
The World Health Organization yesterday said over 60s shouldn't travel overseas. What do you think?
Look, the World Health Organization is taking this very seriously, which is really important, and we are working with them. It's understandable they're concerned about them. No, I would just say, again, we just stick to what we already know, right? Even there's a lot we don't know about the variant. What we know is that the older you are, the more vulnerable you are to this virus, and there are ways to sensibly protect yourself. So if you ask, if it was my mother, I would say to her, she's got her booster shot, so that's great. If she really wanted to travel, wear a mask on the plane and things like that. But I don't think she should be worried about travelling. So that would be my advice.
You talked about South African scientists and how much praise they needed. Again, talking about the World Health Organization yesterday, they said that because of what we did and the fact that we put them and the other countries on the red list, that disincentivises countries to report and share epidemiological and sequencing data. Do you agree?
Well, I think there's a point about making sure that those countries that come forward and share the information, like South Africa did, like the UK did, when we had the Alpha variant. You'll remember that. And we were very open with the rest of the world, just in the same way South Africa is. And that's the right thing to do.
South Africa's a much poorer country than us, and they rely much more on tourism, and they're being penalised,
I wouldn't say they're being penalised. I agree with everything else you just said about South Africa, but it is really important that the rich countries, that they recognise that South Africa has come forward, done the right thing, and offers it whatever support it needs. So on the call that I organised with G7 health ministers on Monday, we talked about this. It was in our final statement about praising South Africa and offering even more support than otherwise. And yesterday, it's one of the reasons I had a call with the South African health minister to offer our support.
So you don't agree with the World Health Organization that it disincentivises countries? You put them on the red list?
No, I think it's important that countries come forward, but there are other ways to support them.
OK. Can we talk about NHS waiting times, please, if we may? National Audit Office report estimating that if 50% of those that have missed their referrals during the pandemic come forward, then the waiting list would reach 12 million by March 2025?
In fact, I think I've previously been on your programme and said it could reach 13 million for precisely the same reason. And by the way, I do want people.
This factors in the money that you hope to raise as well, though, doesn't it, from the national insurance contributions? The rise of next year.
I don't know if it does.
Apparently, it
does. But I don't know. And even if it did, I don't think they would at this point know about all the plans that we've got to get through the waiting list much faster than otherwise because of all the new funding that's coming. But that said, the waiting list will rise before it falls, and it will rise for two reasons. First is that a lot of people that didn't come forward are coming forward. And again, I want them to come forward. I hope it's more than 50%. Even that's more work for the NHS. I don't want anyone to think that they have to stay away from the NHS. And secondly, we've got a lot of demand in any case, even before the delayed demand, there's all the sort of usual demand that would be there. Now, that said, the work that we're doing on, especially on elective procedures and diagnostics with the new community diagnostic centres, with the surgical hubs, this is all going to make a big difference. It is all really helping.
Will things be better by this time next year?
I think we'll be getting through a lot more procedures on a daily basis than this time last year, and that's going to be helping a lot of people.
Will it be better by this time next year?
It'll be better because we'll be getting through a lot more procedures.
OK. Let's talk about the social care plan, because we're almost out of time. We're going to get the white paper. I always think so. The white paper later on today. Will it be clearer by then how many people will have to sell their homes?
The white paper that's coming out today is less about the new means testing system, which is really generous. We thought it would be
where the detail was, didn't we?
Well, no, this white paper, I don't want to... There's a couple of white papers that are planned for adult social care, and what the white paper today is about is in the spending review, there was over £5 billion allocated to adult social care. Of that, just under £2 billion, and £1.7 billion is for what's called it's funding for the adult social care system, improvements to the whole system. So this is about spending on the workforce, on training, on occupational
so when will we
therapy
know
and support.
how many people have to sell their homes?
Well, you will know today is about how we're going to support adult social care much more. When it comes to the question you just asked me about selling homes and not, what we already know, you don't have to wait for that, is that we've already set out plans that means that billions more a year will be going in to support people with their adult social care costs with the most generous means testing system this country has ever seen for adult social care, and with everyone's cost of care being capped at £86,000.
OK, we need another 15 minutes on that, don't we? So I'm sure you'll come back and talk to us about it in more
to.
detail. In the meantime, what are you doing for Christmas?
I'm spending it with my family in Bromsgrove.
OK, just a small group or a big party?
Just my family.
There we go. It's good to talk to you. Thank you very much indeed for joining us. It's always a pleasure. Thank you. And the latest government measures to combat the new variant dominates most of the front pages this morning. The Eye carries Boris Johnson's pledges that everyone eligible for a COVID booster vaccine should receive one, or certainly an opportunity to have one by the end of January. And the Army are set to be drafted in to help administer the jabs. That's in the Metro. The Telegraph says restrictions put into place by the government today could last until March of next year. They will be reviewed every 3 weeks. The Guardian reports the Prime Minister has clashed with his leading scientists by telling people they can party at Christmas. That was just doubled down by the Health Secretary there, wasn't it? But he also said, have a test. And there's an accusation the government is sending mixed messages about what it is and isn't allowed in terms of social gatherings. That's in the Star. While the Mirror alleges the Prime Minister and his staff broke lockdown rules last Christmas by enjoying crowded parties. A Number 10 spokesperson has denied the claims. Still to come on the programme for you later this hour, we're going to be speaking to the Deputy Chief Executive of NHS Providers as it warns the pressure on emergency care is expected to get worse as winter arrives. Tony's Law will speak to a boy who had to have both his legs amputated because of abuse from his birth parents. Also speaking to his adoptive parents about a new law to punish child abusers. And after 8, we'll speak to Labour's shadow Health Secretary, Wes Streeting. Well, let's get more now on what the Prime Minister is calling another great British vaccination effort, should we? Ashna is standing by at a vaccination centre in Farnham in Surrey for us this morning. Hello to you, Ashna. A very good morning. So what's going to happen where you are?
Very good morning, Kay. Yeah, this vaccination centre opens in a couple of hours' time, but it's going to be one of those that's really going to have to ramp up its this distribution of the vaccine, really. The Health Secretary just then, Sajid Javid, calling this a national mission, a national effort, and it really is going to be a monumental challenge for so many of these volunteers, GPs, pharmacists. At the moment, the NHS is managing to give out some 2.5 million jabs per week. There's a real ramping up now to try and make that 3.5 million. But if you look at the statistics, that takes us up to the middle of February. But at the moment, the government has said they want to jab or offer up the booster vaccination to every adult over the age of 18 by January. And that is going to be, well, a big job for those volunteers. As I say, 10,000 of them, some 10,000 of them are going to have to be recruited, a real push there. They are going to be paid, and many of them will be working at sites like this. But we know that there is going to need to be a real distribution of resources. Not only have we heard in the past of, a recent past, of people not being able to get through to their GPs, not being able to have those appointments, and that's going to mean a real knock-on effect if resources are being missed out and being put into things like this vaccination drive, and coupled with, of course, the NHS winter pressures that they're currently facing. There is going to be a huge need for lots of senior management figures who are going to have to look at those charts and look at the people and where they can place them. But really, this is going to mean, inevitably, in some ways, a knock-on effect on so many thousands, even millions of NHS patients.
OK, Ashna, thanks very much indeed. Thanks a lot. So don't forget, 23 million people apparently are going to be slated to have their jab by the end of January. That's what we were hearing from the Health Secretary this morning. But he also said Go to your Christmas parties, have fun, but have a test before you go. Remember, if you are in touch with somebody who's had the Omicron variant as we speak, you need to isolate for 10 days. What might that mean for Christmas for you? Now, 3 students have been killed and 8 others injured in a shooting at a high school in the US state of Michigan. Police in Oakland County say the 15-year-old suspect fired up to 20 shots with a semi-automatic handgun and was later arrested. Those killed were 2 girls, aged 14 and 17, and a boy of 16. Our US correspondent Greg Milam has more.
To that roll call of names in America's epidemic of gun violence, we can now add the Oxford High School, a mass shooting at lunchtime, and 3 teenagers dead. Within 5 minutes of the first emergency calls, a 15-year-old student at the school was in custody, but not before 11 people had been shot and families had endured the panic and confusion.
I'm just so emotional because you never think it's going to happen here, and the kids just are all a big part of this community, and I'm so scared for them. And my daughter is safe, but I don't know if all of her friends are safe, and I don't know if my nieces and nephews are safe. So.
At the suspected gunman's family home, police searched into the night. They say the pistol used was bought by his father 4 days ago. As yet, they don't know any motive. Pictures posted on social media purport to show the student posing with the gun.
Shooting with it, and had posted pictures of a target and the weapon. That's all part of what's being looked at. We're going to do a deep dive on the social media and all the activities of this young man.
So many communities in America have been through this. Michigan's governor expressing what many feel.
This is a uniquely American problem that we need to address, but at this juncture, I think we need to focus on the community, the families, supporting all the first responders, including the incredible people at our hospitals that are working so hard to save the lives of those who are fighting for their lives right now.
And I can tell you're so deep, and as you should be, you're a mom and you're a human being. You're so deeply affected by this. Talk to us about that.
I think this is every parent's worst nightmare.
And once again, an American president forced to offer consolation.
My heart goes out to the families enduring the unimaginable grief of losing a loved one. That whole community has to be just in a state of shock right now.
Police say they're trawling social media and footage from dozens of security cameras. Those who count these things say this is the 53rd school shooting in America this year. Tragically, it is almost certainly not the last. Greg Milam, Sky News.
And some other stories making news for you this morning. More than 90% of people who lost power due to Storm Arwen have had their supply restored, we're being told, but 45,000 are still in the dark 5 days on. The storm affected power supplies to around 1 million homes and businesses across the country. The worst hit areas are in Scotland and the northeast of England. A 3-day strike involving around 50,000 university staff begins today. The dispute relates to pensions, pay and working conditions, with further action threatened if a deal can't be reached. The actions will affect 58 universities across the UK, disrupting teaching for students in the run-up to the Christmas holidays. Experts are warning more than a quarter of UK birds are seriously threatened. The UK's leading conservation organisations found swifts and greenfinches are some of the species most at risk and are on a conservation red list. It means they're of highest concern because numbers are well below historical levels. A new survey for World AIDS Day, which is today, has revealed that there is still stigma and prejudice around HIV 4 decades after the disease emerged. Nearly 90% of adults surveyed in Britain were found to have negative perceptions toward those with the virus, as Ivor Bennett reports.
There is now a danger that has become a threat to us all.
A lot has changed since this public health campaign in the 80s, when the aim was to sow fear.
If you ignore AIDS, it could be the death of you. So don't die of ignorance.
But that fear in turn created stigma and prejudice, which those living with HIV still endure today.
I heard so many people when they were told And then when they told their family, people start disinfecting cutlery, disinfecting everything around them. And the continuous question, what do you do? How did you get it? Like, you know, you must be promiscuous, so you must have done something.
And that's even now, even today?
Yes, even now, even today.
Sylvia's been living with HIV since 1997, but she didn't share her diagnosis for 7 years after that. Now she leads a charity helping others with HIV to overcome any sense of shame and improve their quality of life.
We have pills for HIV, but we don't have a pill for stigma. Stigma can only be overcome by, you know, by information, by dialogue, by seeing that somebody living with HIV is just like you and me. It's no different.
According to a new study, nearly 9 in 10 adults in Britain have negative perceptions towards those living with HIV. Nearly 3/4 don't know that medication prevents sexual transmission, and staggeringly, more than 1/4 wrongly think HIV can be passed on through kissing. To mark World AIDS Day, the government's unveiled a new action plan to end HIV infections and deaths by 2030. Scientists say it is achievable thanks to treatment advances, but only if stigma is tackled too.
Stigma prevents people from coming forward to have a test because they're scared of being known to be positive, they're scared of accessing services, and if you don't test, then you can't be diagnosed and you can't have treatment.
High-profile figures like former rugby star Gareth Thomas coming out as HIV positive has helped change perceptions. The actor Charlie Sheen is another. But there's yet to be a high-profile woman to reveal their diagnosis, which risks hiding another reality that HIV can affect anyone, something Sylvia and others are trying to show. Ivor Bennett, Sky News.
Quick look at I should say that we're chatting to David Furnish, who's married to Elton John. Of course, his foundation has done amazing work for those that are struggling with AIDS and also AIDS awareness. That at 8:30. Quick look at the weather.
Look forward to brighter skies. The weather, sponsored by Qatar Airways.
Next few days, cold theme returning, showers becoming wintry from the north. Rather chilly and windy start with showers around, some heavy and squally in the south and west. Expect some wintriness on the Scottish hills as well.
The weather, sponsored by Qatar Airways.
And some of the other stories that have caught our eye in the newspapers for you this morning. This in the Mirror. One very brave young man has become one of the youngest people to ever climb Snowdon. He's only 4. His name's Albie Jr. Thomas. He scaled the highest mountain in Wales with his dad, Daniel, despite having one of his legs amputated when he was just 15 months old. The pair made the trip in aid of cancer research. Let's see if we can try and get him on the programme tomorrow. What a brave little chap he is. Also, how's this for sustainable fashion in the Times newspaper? That's Maria Sharapova. She was snapped at the Fashion Awards wearing a custom dress using material made from Evian water bottles. Will it catch on? See, things like that, things like I thought of, how flexible is it? What if she needs to go to the loo? That sort of thing. Don't know, but it looks pretty nonetheless. And in the Express, a very close call on a nature reserve in South Africa where a jeep on safari was attacked by a 6-ton elephant. It pushed it off the road. Thankfully, no one was hurt besides the vehicle itself. But in my experience, crazed 6-ton elephant. Elephants don't do that unless they are provoked in some way or spooked in some way. So let's not be too critical of the Elephant Daily Express sub-writers this morning. Thank you. And one-way traffic, I think that might be an understatement on this next one. Check this out. England women's football team last night beat Latvia 20-0 in their qualifying match for the Women's World Cup. Ellen White became the team's all-time leading goal scorer on the night, now leading the way with 48 goals for her country. And it was a record-breaking night for England too, with the scoreline being the Lionesses' biggest ever win. 20-0 Nil. That's just showing off, isn't it? Coming up, I'm going to be speaking to the Deputy Chief Exec of NHS Providers, which represents most hospitals in England, as it warns that emergency care faces significant pressure this winter. Hello again, everybody. Did you hear the Prime Minister yesterday? He was saying 23 million people will be offered a booster by the end of next month. But in the meantime, you should all have your Christmas parties and everything will be hunky-dory. Well, the Health Secretary Sajid Javid, we were speaking to him in the last half hour about the government's measures to contain the variant. Mr. Javid told me there's no need to change any Christmas plans, echoing what the Prime Minister said. But he said, well, this is what he said.
People should continue to behave in the way that they were planning to behave over Christmas. I don't think there's any need to change those plans. The only changes that have been made in the last few days are the ones that everyone now, I think, knows about it might affect your international travel plans. So if someone had plans to travel over Christmas, then there could be an impact there, of course. There's the need to self-isolate if you come into contact with someone with Omicron.
Yeah, are you worried about a pandemic?
No, I'm not. The case numbers are well, at this point in time, the case numbers are very low. I think throughout the UK, we've got 22 confirmed cases at the moment, and that will go up. It will certainly go up, but the numbers are low. I hope it sort of stays that way. So I'm not worried about the sort of pandemic type situation.
Tamara's here. Thoughts, Tamara? Good morning.
Morning, Kay. Well, this is again frantic attempts to dampen down what Jenny Harries, who's the head of the Health Security Agency, so senior advisor to the government, said yesterday, which is that people should cut down on unnecessary socialising and that working from home might be a good idea. Why are government ministers going out saying, please don't cancel your Christmas plans, go to your parties, go to your children's nativity plays? Because, of course, yes, in pure health terms, it is correct that if you don't go to a Christmas party or don't have a nativity play, you are less likely to get COVID. But the government's message in the face of great uncertainty about the Omicron variant is that any moves in that direction are going to have a big knock-on effect on the economy, particularly the hospitality industry at a crucial time for them around Christmas time, and they don't want people to overreact. So Sajid Javid is saying that at the moment the official advice is that you can carry on your social life as normal, but that he would personally, if he was going to a Christmas party, take a lateral flow test first. Of course, you can't guarantee everyone else has taken one too, but he says that's a good way of protecting yourself. So the government are saying, look, the restrictions are in place, are on masks, are on compulsory quarantine, and that is as far as they are going for now. We can't say how far we may need to go in the future. In the meantime, they hope to ramp up the booster programme, but at the moment, only over 40s can book their boosters. Yes, 18 to 40-year-olds will be able to have one at some point between now and the end of January, but they have not been invited to book one as yet.
OK, Tamara's for now. Thank you. Tomorrow's Take at 9 o'clock. Looking forward to it already. Thank you. And, of course, hearing from the Shadow Health Secretary in the next half an hour. Now, a new report has revealed that hundreds of thousands fewer referrals for suspected cancer were made by GPs in England since the start of the pandemic. Joined now by Eve Byrne from Macmillan Cancer Support, and also Craig Russell, whose daughter Kelly died from bowel cancer in June of 2020. Hello, welcome to you both. Eve, to you first of all, if I may. The pandemic has been challenging for everybody, none more so than people who are suffering from cancer. Give us some thoughts on that, if you would, please, Eve. Good morning.
Good morning. Well, of course, this is a really difficult and worrying time for people living with cancer. We know that from the report today that between 35,000 and 60,000 fewer people than would have been expected started their cancer treatment. So we're really worried because obviously this is causing great anxiety for people living with cancer, and we're hearing that on our support line, people who are seeing disruption or delays and are worrying about what that might mean for their prognosis or their experience or their outcomes. But also we're worried because there's a lot of people out there who haven't come forward during the pandemic who now will be coming forward, and we're encouraging them to do so. But of course, that's going to create more pressure on the NHS, and we need the government to be taking action in their plans coming out in the coming weeks to really address those pressures.
Craig, your daughter Kelly died. She had had bowel cancer for about 3.5 years. She was in the middle of chemotherapy during the pandemic. What happened?
Well, she went in for chemotherapy as she was scheduled to do, went through the blood tests, and at that point she was called in to see the oncologist, who advised her that the correct course of action at that time was to stop the chemotherapy and to self-isolate for 12 weeks. The concern was with a suppressed immune system that the catching COVID for Kelly could have been extremely serious. So that was the advice that was given, but it was something that Kelly and the rest of the family certainly didn't agree with, because the chemotherapy was the only thing holding the cancer back. And subsequently, 12 weeks after she was told to self-isolate, she passed away.
My goodness me, leaving a little boy behind as well. Eve, I'm guessing that you've heard stories like this time and again. What can we do to try to stop the sort of grief that we're seeing the Russell family having to deal with from happening to others?
Well, this story is just awful, and unfortunately we are hearing many stories like it at Macmillan Cancer Support, and I would encourage anyone out there who is worried to get in touch with us, because our support there is for you. But what we really need at the moment is the government to be taking the action to increase capacity in the system. It is not just about increasing capacity to diagnose people with cancer. It's also about increasing capacity to treat those people when they do come into the system. We know the government's bringing forward plans in the coming days and weeks to address the capacity pressures, and we really need to see cancer be put front and centre to make sure that people get the treatment and care and support that they need as soon as they need it.
Craig, tell us about your grandson. He's Kelly's son, of course. He's nearly 8, is he?
He's 8 in just a few weeks, yes.
Tell me about him.
He is a remarkably well-adjusted boy, considering not just losing his mum, but everything that he went through during the time that Kelly was ill. He is remarkably well-adjusted, really. He is, to a large extent, just like any other 7-year-old, the same mischievous ways, same sense of humour, and he has proven to be remarkably strong. In some respects, perhaps the strongest member of the family.
What's his name?
Finley.
Finley, what a lovely name. When's his birthday?
It's just 3 weeks. 3 weeks to go.
Oh, okay. Well, mine's the 17th. Is it on or around then? Maybe we share the same birthday.
Just before.
Oh, okay. Okay. Well, I hope that I hope he has as good a birthday as he possibly can, and Christmas is a little brighter for you this year as you move forward after the loss of your darling daughter. Thank you both for taking the time to join us this morning. Thank you. National Audit Office is warning that the backlog of NHS care in England could hit between 7 and 12 million by early 2025. Hospitals are warning that urgent and emergency care is already under significant pressure, and now they face the looming threat of the new Omicron COVID variant. Joined now by Saffron Caudry, Deputy Chief Executive of NHS Providers, which represents most hospitals in England. Good morning to you, Saffron. I was speaking to the Health Secretary a short time ago, and he was saying could reach 13 million. And we're really, really struggling with call-outs for ambulances. Where are we going with all of this?
Yes, well, it is true to say that the health service is under immense pressure at the moment. And, the last thing that anyone wanted to hear was that we have a new variant of COVID to also grapple with, because trying to deal with that backlog of care is immensely challenging. We've got huge staff vacancies, and we are also looking, as you said, at the huge pressure on urgent and emergency care and other services, including mental health and community services. The thing that we do know is that the NHS already has experience in managing these huge pressures. So at the moment, we've got 6,000 patients in hospital with COVID. At the peak of the pandemic, we had 34,000 patients in hospital with COVID. So, you know, there is room to expand that capacity to deal with COVID increases, but we really hope that we don't get there. So I think it's fair to say that the NHS is kind of on standby to expand its capacity should it need to do that. But it does come at a cost, and that cost will be potentially cancelling routine operations, longer waits for people who come into A&E, for example. So we know that those challenges are there.
One aspect that is stretched to the limit, of course, is emergency ambulance calls. 1 million in October. That's a staggering number. Some people dying in ambulances because they can't get the care that they need, waiting for hours to get into A&E. Do we have to accept that the quality of patient care has deteriorated for now?
I think we have to accept that the NHS is under huge pressure, and that does mean that things won't happen in the timescales that we want them to happen. And we know that this, ambulance services in particular have been under such huge pressure, and there is that real challenge in terms of handovers between ambulances arriving at hospitals and patients being able to be admitted. That's part of a wider picture, and that's what we have to remember, that this isn't just about the health service, it's also about the health and care service. And we have said for a long time that what we need to see is some real changes in the level of support for social care so that we can make sure that those who need care in the community receive it, so that they can be discharged from hospital and help create that extra capacity in hospital, so that we don't have these blockages that we see in certain parts of the system. So it's quite a complex picture when you start to pull it apart. So it's not just about, can't we get ambulances out there faster? Well, the ambulances are there, but unfortunately, there is this complex chain that needs to take place in order to admit patients into hospital and have that capacity. So we know there are huge challenges. Mainly, those challenges come down to workforce, actually, in terms of having the available staff there to be able to treat patients.
Okay, I wonder if I might, we're almost out of time. I wonder if I might be able to ask you just one further question before I let you go. And that is that the Prime Minister yesterday said that we should have Christmas parties, carry on as normal. His chief medical advisor saying, no, we shouldn't. You shouldn't go to Christmas parties unless, you just shouldn't go. What's your view?
Well, I think this is such a tricky and challenging issue, isn't it? Because we're at the point this year, very different to last year, where it was absolutely clear that nobody was going to a Christmas party last year. This year we are in a slightly different place. People will be taking their own decisions. We know that many NHS trusts, for example, are asking their staff not to mix in big groups in the run up to Christmas because of the potential threat to their health and what they will be available to do. So, they are setting one example there. And I think at the moment, without that advice from government, I think it's for individuals and individual organisations to think about what they will be doing in the run up to Christmas. But, it's a really challenging and difficult one. And the thing we can encourage everyone to do is to go out and get their booster when it's made available to them, and to book in for that, because that's one of the best defences that we've got, alongside wearing masks, washing your hands, and also making sure you're in ventilated rooms. Those are really, really important factors which will help stop the transmission.
Okay, it's good to talk to you. Thanks for your expertise.
Thank you.
Still to come, the government has backed new legislation cracking down on child abusers. We're going to be speaking to a family who've been campaigning for changes to the law for 4 years. Birth parents did that to that little boy. Child abusers in England and Wales could face a lifetime behind bars under new proposals introduced by the government this week. The legislation would raise maximum penalties for those who harm children. Why would you harm a child? And it would mean that for the first time, anyone who causes or allows a child's death can be hit with life imprisonment. Follows a 4-year campaign for Tony's Law, named after Tony Hudgell, who had to undergo amputation surgery due to abuse from his birth parents. Well, it has a happy ending because Tony's got new mum and dad now, Paula and Mark. All three of them are with us now. Hello to you all.
Good morning.
Good morning. Who's ready for school there?
Not me.
Tony abused as a child, as we know. I don't know how much you talk about it in front of him or what you can say, but Paula, Mark, tell us what you can.
Yes, so Tony came to us as a foster baby at 4 months old. He was very shut down, withdrawn, and very, very tiny. Both his legs were still in plaster. His arms had only come out of plaster the day before. He'd suffered multiple fractures and then became very, very poorly with sepsis, toxic shock and multi-organ failure. He's like just strives along. We adopted him. He's the light of our family. Last year, he did a walk and raised 1.6 million for the Evelina Children's Hospital on his new prosthetic legs. And now he's managed to change the law. So, yeah, incredible.
There he is, Dad. I think we've chatted before, haven't we? Mark, it's amazing what he's done. It's also amazing that someone that could do that to him doesn't get life in prison. Up until now, I think we can say in front of him that his birth parents were sentenced to, 10 years in jail? You didn't think that was enough?
No, I mean, they were sentenced to 10 years in jail and they serve 5 and come out next year. Under the new legislation, that would be 14 years. But also now they would serve 2/3 of that. So it'd be more like 10 years than the 5 years that they've served.
You've had a lot of support, haven't you, Mum? Not least, I saw some pictures of him running riot in the Deputy Prime Minister's office.
Yes, he literally was running riot. I think he tried to rewrite Dominic Raab's speech as well. He was at his computer. He's nodding. We had a great time. Dominic Raab was very accommodating, lovely guy, who said that the government had backed Tony's law, which now means that, like Mark said, the maximum sentence with Tony, because he survived, was 10 years, whereas now that's up to 14 years. But whereas where if a child died, it was only 14 years, that now is up to life, which is a massive achievement. We're extremely proud that we got there. Obviously, these cases still need to get to court, which is obviously a little bit difficult. And also, I think I sort of surprised Dominic Raab. He asked if there was anything else he could help me with, and I said yes, we need a child cruelty register, which he was surprised actually we didn't have. And unless you sort of think about it, you probably don't realise that there isn't one. You assume there is, but actually there isn't. So these perpetrators can come out of prison. Once they've served their licence, they're free to do what they like. So they could actually be around children, have more children themselves, which obviously is
ludicrous. Yeah, absolutely.
Yeah, absolutely. Yeah.
Tony, tell me, what's your favourite subject at school?
What do you like doing most?
Writing.
Writing.
Say that again. Writing. When I used to ask my little boy what his favourite subject at school was, he used to say lunch. So I'm glad that you're saying writing. What do you want to do when you grow up? When you're even bigger?
What do you want to be?
Maybe a journalist like me?
I want to make pizzas.
You want to make pizzas? Excellent, excellent. What's your favourite pizza?
Pineapple.
Bit controversial, that, pineapple on a pizza. But if that's what you like, I bet if you ask your mum and dad for that for Christmas Day, you'll get it. I'm just saying, no pressure on them, but I think that's what might happen. Sorry about that, mum and dad. Tony, you always steal the show, young man. Thank you so much, all of you, for joining us, and you've been an absolute star. Yeah, go on really quickly. We're almost out of time.
Yeah. All right, okay. We've set up the Tony Hudgell Foundation. If anybody wants to check it out, TonyHudgell Foundation.org. We're doing a Christmas present appeal, and it's to help other children from abuse backgrounds.
Okay, fantastic. Well, you've done it yourself, so I don't need to do that. Thanks very much indeed. Be a good boy, Tony, and I bet you a pound that Father Christmas will come and spoil you this year. Do you promise to be a good boy? Excellent. Looks mischievous to me. Thanks, Mum and Dad. Thank you. We're back in just a moment.